Most people think of healthcare as something that only happens in hospitals or clinics. But in reality, healthcare is quietly happening around us every day, on our phones, in our homes, and even while we sleep. Technology has changed how we communicate, work, and live. And without many of us noticing, it has also reshaped how we understand, monitor, and protect our health. Today, we're exploring the role of technology in modern healthcare, not from a futuristic or science fiction perspective, but from a very human one. We'll look at how technology is influencing prevention, diagnosis, treatment, and daily health decisions, and what this shift really means for your body, your mind, and your long-term well-being. For most of human history, healthcare has been reactive. We waited until something felt wrong, then we sought help. Technology is slowly changing that model. Wearable devices track heart rate, sleep patterns, activity levels, and even stress responses. Smartphones collect health data passively, without requiring conscious effort. This doesn't just create numbers, it creates awareness. When people can see patterns in their sleep, movement, or energy levels, health stops being abstract. It becomes personal, measurable, and immediate. So instead of asking, "What's wrong with me?" we start asking, "What patterns are shaping my health?" Health is not just physical, and technology has played an unexpected role in highlighting the connection between mental and physical well-being. Apps designed for meditation, stress management, and emotional tracking have made mental health more visible and more acceptable to talk about. At the same time, digital overload, constant notifications, and screen dependency have introduced new challenges. This creates an important paradox. Technology can support mental health, but it can also strain it. The difference often lies not in the tool itself, but in how intentionally it's used. Modern healthcare technology is beginning to recognize this balance, integrating behavioral science with digital design to support healthier habits rather than constant stimulation. One of the most powerful contributions of technology is early detection. Artificial intelligence is now being used to analyze medical images, identify patterns in large datasets, and assist clinicians in making more accurate diagnoses. This doesn't replace doctors. It supports them. By reducing human error and processing vast amounts of data, technology allows healthcare professionals to focus more on judgment, empathy, and decision-making. Earlier detection means earlier intervention. And earlier intervention often means better outcomes, lower costs, and less physical and emotional burden on patients. In many cases, technology doesn't just extend life, it improves quality of life. Healthcare access has never been evenly distributed. But technology is narrowing that gap. Telemedicine allows people in remote areas to consult specialists without traveling long distances. Digital health platforms provide education, monitoring, and follow-ups that were once limited to in-person visits. For many, this means healthcare becomes more consistent, not just available in emergencies. It also empowers individuals to take a more active role in their health, rather than being passive recipients of care. When information becomes accessible, people become participants, not just patients. As healthcare becomes more data-driven, the conversation around privacy, ethics, and responsibility grows more important. Who owns health data? How is it protected? How do we ensure technology serves people, not the other way around? The future of healthcare will not be defined by innovation alone, but by how wisely it's integrated into human life. Technology has the potential to make healthcare more personalized, preventive, and humane, but only if it's guided by clear values and thoughtful use. So what does this mean in real life? Here are a few grounded ways to think about technology and your health. First, use health technology as a mirror, not a judge. Data should inform awareness, not create anxiety. Second, focus on trends rather than daily fluctuations. Long-term patterns matter more than single readings. Third, balance digital tools with offline habits. Movement, sleep, and real human connection still matter deeply. Fourth, stay informed but selective. More information isn't always better. Clarity is. Small, intentional choices often create the biggest health impact over time. Technology is not replacing healthcare. It's reshaping how we engage with it. At its best, Modern healthcare technology helps us understand our bodies better, notice changes earlier, and make more informed choices. Health is rarely about dramatic transformations. It's about awareness, consistency, and understanding how small signals shape long-term outcomes. And in that sense, technology is simply a tool. The real progress begins with how thoughtfully we choose to use it.